Welcome back to our discussion about bone health. I'm here with Dr. Marcy Goolsby and exercise physiologist Calissa Hall. In this section, we'll dive into what women can do to protect and strengthen their bones and some common risk factors and discuss key strategies that help support long term skeletal health. So, first, could we hear the terms bone density, osteoporosis, osteopenia? Could you just sort of define what those mean and then what things could be done to prevent them?
So, low bone density is the term that we use now for what we used to call osteopenia, but it's the same thing. Depends on whose definitions you use, how that's defined, and it depends on the population and the age. But osteoporosis generally means a T score lower than minus 2.5, but along with other factors. So even if your score is not that low, but you've had osteoporosis related fractures, you can get the diagnosis of
And
osteoporosis.
what's a T score for
A
people who
T
may not have
score is
heard of it?
essentially like a standard deviation if you ever had to take statistics. So comparing to sort of the average, if you were exactly average, you'd be zero. Anything in the negative means you're lower than average, and anything in the positive means you're better than average. And then the younger population, just to make it more confusing, we use a different score called the Z score, which is comparing to somebody your age, your gender. And those are slightly different definitions. And again, depending on which group you use. But the critical piece there is often the score and the other risk factors. So if somebody who's younger is not menstruating, is not getting their period, and they have, a certain score, that can help sort of determine what we call it. But regardless of what label it is or what definition, you end up getting, it's the treatment and the approach that's really important.
And are there ways that women can preserve their bone health when they've reached menopause or maturity?
Absolutely. I mean, as you mentioned, we're kind of trying to identify the risk factors and trying to reduce those risk factors. Having a low body weight or an unhealthy body weight or low BMI can often indicate that you're maybe not getting enough nutrients. So then that may lead to those vitamin D or calcium deficiencies. So we want to make sure that we're providing our body with the right nutrients, getting protein so that we can build muscle, that we can support the exercise. That's super important. We can also limit the consumption of alcohol and smoking because those have been linked over and over again to reducing bone loss. So little things like that can make a difference. But then exercise, fall prevention, that's key. We need to make sure that our bodies can support ourselves if we do fall, and we want to make sure that we prioritize load bearing, weight bearing, strength training exercises that are going to create impact and really start building those muscles to apply loads and forces to the bones. So if we can identify those risk factors and then aim and our goals towards reducing those risk factors, that's going to be the biggest key.
And what about in a younger population? You've talked about how you sort of hit that peak bone mass in when you're 20 or whatever. So in your early phase of life, what are the things that young girls and young women can be doing to maximize their bone health?
Well, education is key. Early education from the get go is key, making sure we understand the menstrual cycles and the peak bone mass stages and how that can impact not only our activities and sports, but just our everyday life. But just making sure that we're doing our proper exercises and we're not just going out and participating in a sport and not prioritizing the strength training and the resistance training and the supporting to the bones and the joints. But then also just making sure that we're doing them properly. We want to build habits early. So if we're doing exercises incorrectly in our 16, 17, 18 in our gym class, and then we carry those habits with us for the rest of our lives, then we're kind of setting ourselves up for potential musculoskeletal issues, deficiencies, and then that creates a whole nother slew of issues. So we want to make sure that we're educated. We're educated about protein and calcium and how that affects our bones, and just making sure that we're building those habits early.
And I would add, creating the right culture in sport, especially in our young women. Thinner is not better when it comes to endurance running, and just understanding that, and hopefully educating coaches and parents and athletes themselves about the value of nutrition and exercise and the differences in body composition. Doesn't mean you have to look like this to run like that. And really focusing on the performance and fueling appropriately is important. And then um, the other thing that we can't control is our genetics, but knowing your genetics. And I think that's difficult because there's probably a lot of there are still a lot of people out there who have or have had osteoporosis who didn't know it. So when I see patients, I'm asking about family history of osteoporosis, but I'm asking about, has anybody broken a hip? Anybody fall and break a hip? Because those people almost always have osteoporosis, and so we'll kind of use that as another marker in their family history.
Yeah, are there certain populations that kind of the light bulb goes off with you that you think are at higher risk in general for bone health issues?
Yes, there definitely can be some differences depending on your ethnicity, for example. So Caucasian, lighter skin, Asian, those are two that often have higher risk of osteoporosis.
And are certain types of sports more associated with issues with bone health, or
Um,
lack of sports, I guess,
Yeah,
being
I mean, lack
sedentary?
of sports is the biggest.
Mhm.
So somebody who has been sedentary, hasn't been exercising in their life, is the biggest risk. Somebody who's has a low BMI, who's very thin, is a risk. And then in terms of the sports, we talked about some are better than others, but all of them are great. All of them are better than none. So even swimming, because you are pulling on the bone with your muscles, there's still some benefit there. And then we mentioned the multi-directional sports. And then the other one is running is not bad for your bones. But if you're running and you're burning so many calories and you're not getting enough nutrition, you're not getting your period, well, then it is detrimental. And so that's something to think about in terms of risk factors.
And what about if someone's had previous bone injuries, previous, let's say, stress fractures or whatever, does that predispose them to having more bone health issues later in life?
If they've had recurrent bone stress injuries or certain ones that we consider high risk, like the hip, that is more of an indication for you to do a little bit more digging. So it's not that the stress fracture in and of itself is a risk for bone loss, but that they got that probably because they did have some imperfect bones. That's not always the case. There's other factors that play a role, but it definitely merits a deeper conversation and potentially a little bit of a deeper workup so that you can identify those patients as soon as possible, have that education, bringing in nutrition, mental health providers, whoever you need on your team, exercise physiologists, physical therapists, to sort of all come together to create the right team to help this person get out of that negative bone health issue that they're having.
And what about medications? Are there certain medications that have either a positive effect or a negative effect on bone health?
There are a lot more medications for osteoporosis treatment than we used to have, which is great. So you can target it in different ways at different times. And I won't go into the nuances. That's not really my area of specialty, but there are a lot of medications. And I think in general, there's been a little bit of a bad rap in the media on some of the potential negative consequences and the risk. But your risk of having a fracture from osteoporosis far exceeds your risk of having some of those potential things. Hormones are really important. So in the perimenopausal years, we do know that hormone replacement therapy, particularly when given at the right time, can prevent that to some degree the bone loss that occurs during menopause. And there are some medications that can have negative consequences that you need to be aware of. So if somebody has a medical condition that requires them to be on ongoing or frequent bouts of steroids, for example, that has negative consequences to the bones. In some patients with breast cancer, they need to be on aromatase inhibitors, which is a certain medication depending on your estrogen sensitivity for the breast cancer. And those we know have negative consequences on the bones. And then there's some others like some certain stomach pills, certain medications for seizures. So it's important that that conversation is had with your provider if you're on those medications long term.
Yeah, I mean, medications are certainly out of my scope of practice, but I get asked about them all the time. And there's definitely some medications that can weaken your bones with longer use. So my advice is always just keep the communication open with the doctor, making sure that your team is communicating and giving the right messaging with regard to that, and just monitoring those symptoms.
And what about like calcium, vitamin D, or other micronutrients? How do those factor in? And what is your typical advice to your patients regarding whether you need to be supplementing with those things?
I mean, I think it's important to have that conversation. So again, if I'm seeing somebody for a bone health consult or somebody who's had stress fractures, I will ask about their nutrition. And this is again where involving a nutritionist can be very beneficial to sort of take a deeper dive into their nutrition intake to see if they're getting enough calcium. It's always better to get the calcium through your diet if you can. So unless there's a reason like somebody's lactose intolerant, I usually try to get them to increase the dairy or other calcium-rich
So you're
foods.
not
But dairy is kind of
prescribing calcium to everybody. sort of.
no, more is not better in
Yeah.
calcium sense either. We don't want somebody to get a kidney stone from overtaking calcium. But it's important that you get the right amount. And depending on your age and your situation, like if you're pregnant or breastfeeding, those are times where you have a higher need for calcium, for example, determines kind of how much you need in the day. So I'll usually have people try to do a dietary calcium calculator. Just Google it online, find one, get a rough idea of what you get in your diet and either add something in, which would be ideal, or if they feel like they can't, then adding a supplement just to make up the difference of what your sort of goals are and what you're getting through your nutrition. Vitamin D is a little bit different. It's a little bit more difficult to get it through food, and there's a little bit more of a genetic component to it as well. So if you have a low vitamin D, you may not know it, you wouldn't feel it, and you may not be able to make up for it through nutrition. So that's one where we would probably supplement. So I often test to see where they're at and then supplement as needed based on the result. And you can tend to talk about vitamin D in the sun if you want. I didn't mention
I was
that.
going to say, we're not in the 50s where we're with our silver plate trying to bake our faces, but let's the sun is definitely the best place to get your vitamin D. So we definitely need to get out, get the fresh air just for stress management and our mental state of mind. But yes, we do want to try to get it naturally if we can. And then, of course, I always refer back to the nutritionist and the doctor to make sure that we're at the right levels to prevent that risk factor from being an issue.
Yeah, I was just wondering if you have sunscreen on, does that affect whether you get the effect
You
of
can still get the benefits of vitamin D through sunscreen. So yes, wear your sunscreen. That's
Yes,
the first
sunscreen
statement.
for other reasons, but
Yes.
yes, it does impact the absorption of the D some. So
Yes.
sometimes people will be like, just 10 minutes midday,
without the
15
sunscreen?
minutes without the sunscreen, walking around outside, you probably get the most bang for your buck. But it's difficult. I mean, today is not a day we're probably going to get a lot of vitamin D here in New York City. So we do obviously see a higher rate
Yeah.
of vitamin D deficiency and insufficiency in the higher latitudes.
Right.
Yeah.